everyone, my name is Dr. Lal Walath and welcome to another series where we're making 3D printed intubation trainers, models and other simulated models. We've actually 3D printed an intubation / bronchoscopic model for use around the world, especially in austere environments, using very cheaply available materials. This project is an endeavor by all of us, and I think we should all introduce ourselves before we start heading on to that side over there.
I'm Dr. Moshe, I'm one of the ER attendants.
I'm Dr. Ahmed, I'm one of the pulmonologists and critical care physicians.
I'm Dr. Papari, I'm an internal medicine resident.
I'm Michael Jardina, the ER educator.
And my name is Dr. Lal Walath, I'm an ER resident. So, we've all realized that bronchoscopic trainers is something that all critical care residents / providers should know. And I think it's high time that we all step forward and make something cheap and widely available, which can be used by almost anyone, especially in education, whether it's medical students, residents, or attendings. So to talk about how important bronchoscopic is, we've got the two critical care experts.
I will talk about a few points why it is very important for the ICU residents and the ER residents to have the bronchoscopic skills. In my view, in the ICU, when patients are intubated on the ventilator, mucus plugging is very common. That can cause sudden severe hypoxia, and if you have basic bronchoscopic skills, you can go in to the lungs with a bronchoscope, do therapeutic aspirations, and patients recover immediately. So that's number one. You can, if you have bronchoscopic skills, you can identify the source of the hemoptysis and do some basic foreign body aspiration. So I think from the resident's perspective, if you have basic bronchoscopic skills, these are the three biggest indications that they would need their skills to help the patients in the ICU.
From an ER perspective, bronchoscopy is very important in resuscitation. Oftentimes we see the mucus plugging down in the emergency department too. And it's not easy to get the call in like another profession to come in to help clear that mucus plug. From a training standpoint, getting practice with bronchoscopy is not easy to do in the hospital. Usually these patients that you're trying to do this urgently on are already very, very sick, and to set up for repeated practice with different levels of skill, very difficult to do. So to have a trainer where you can spend the time getting used to the equipment before the emergency happens, very important, as opposed to trying to do this with a crashing patient.
All right, so we did this using two different freely available models on Thingiverse.com. One from Decent Simulator and another from DC Tink. They were printed on a very basic mid-level 3D printer that's available to anybody with very basic settings. So it ends up coming across as a 48-hour print in the end, using standard PLA with an estimated cost of about $50 to $60 for the entire model itself, including these large pieces, the negative space, and even the hardware to keep the model together while it's pouring. It ends up being a 0.2 millimeter layer, 0.02 millimeter print layer, 7.5% gyroid infill, and otherwise all just basic settings that come default on any printer itself. We are going to mess around with it a little bit to get it even more detailed with an even finer print.
So the parts that we have over here are the mold, the inset over here, which is going to help you, which is going to be the actual, once the mold is filled with silicone, this is going to be the actual part where the bronchoscope will go through. And we have the model for the trachea and the bronchial tree over here, which will attach to the bottom. And for this part, the 3D printed model is the part that the bronchoscope will go through. To make the model over here, first we're just going to place this inside. Got 4 easy screws that can just be screwed in to secure the mold. We'll be setting the tracheal part aside, and the main mold here that we're creating is we're using silicone rubber. So that comes in two parts, a part A and a part B. They're to be mixed in an equal 1:1 ratio by weight. You can find a lot of different kinds of silicone rubber with different hardness. What we're using here today is a 15A. That's kind of in between where you're not going too soft where it's crumbly versus too hard where it becomes like a solid piece. So these need to be mixed in an equal 1:1 ratio by weight. We already have them portioned out in 19-ounce bottles, so we're just going to mix those two together. For that though, I'm going to put on some gloves and a mask.
As they start mixing, I'm going to put the releasant. This is a silicone releasant that's going to help make sure the mold doesn't stick. While they mix the proportions, I'm going to come right back. Just an added thing, if you're making this model at home, you can always add some color to it. There's specialized colors which you can get to actually color the latex skin color or whatever color you want, which may add some realistic features to it.
So what we're doing over here is just trying to make sure that we've got as even a mix as possible by ensuring that we make sure they're mixed in multiple batches. The silicone has a setting time of about 5 to 8 hours at 25 degrees Celsius, which is about room temperature right now. But we can see how that goes. The top layer of the silicone that's exposed to air sometimes gets a little bit sticky, so we'll leave it until we see that it's set pretty well. We have, along with the rest of the 3D printed model, we also printed a few releasers into the side of the model. That is over here. And that they will help with getting the silicone mold, getting the silicone out of the mold. So as we talked about earlier, we used a releasing spray, which you spray on the inside of the mold, and that helps the silicone just slide right off. Okay, so now that we've got that all mixed together, we've got the silicone in batches and we're going to pour it into the mold. So we'll be back in about 5 to 8 hours until the surface of the silicone feels not too sticky to the touch, and we think that the inside has moved. Thank you. Okay, so now that we've done that, we used a blade and cut off all the excess little silicone scraps to get our final model over here. So as you can see, we can clearly see the teeth, you can see the tongue and the uvula. And when we go in with our bronchoscope, we'll be able to see the vocal cords as well as the tracheal rings that lead into 3D printed bronchial tree model. So this is the finished model, and it's ready for basically bronchoscopic training or for intubation training, both of which we're going to demonstrate right over here.
Right now, yeah, so got my Mac blade, getting down on my knees,
As every good ER provider should be.
Yep, it's in. That took some finessing, but it's in. 24, and now obviously we don't have like lungs to see whether we're in the airway or not, but I could see it. But the best test is just pass the bronchoscope through, and you can hear the sound that it's in. Obviously we don't have a camera to see where we're going, but it's in, and that demonstrates the proof of concept. Anything else?
And when we use the model, there would be two additions. One would be, obviously we'd have a syringe attached over here to inflate the cuff, double check and make sure we're in the, and like we said, to double check and make sure that we're in the trachea. We take the bronchoscope and go through. At that point, we'd have it attached to a camera, so where we could use the bronchoscope and go through all the different bronchi and basically confirm that we're in the right place.
So we'll give more updates as this project grows, but thank you all for kindly listening to us.
Thank you.
So we're going to start with the first trial run of the bronchoscope. We've got Dr. Hamid here.
So this is a 3D printed model of the lung. So what you guys are looking at right now is the interior of the trachea. So you can see this is the endotracheal tube. Once you come out of the endotracheal tube, this is the interior side of the trachea, the posterior side, and you can actually see how good the 3D model is, because you have the cartilages that are anterior and you have the membrane that's posterior. And as we go down, you can see the carina there, the right mainstem bronchus, the left mainstem bronchus. As you go into the right mainstem bronchus, you can see the right upper lobe take off, the right bronchus intermedius, and as you go down, that should be the right middle lobe and the right lower lobe. So it's a pretty good 3D printed model of actual lungs. So now we're back to the carina, and then we're going to go towards the left lung. As we are going towards the left lung, that's the left upper lobe and the left lower lobe. As we go into the left lower lobe, you can see the bronchoscope coming out of those small bronchioles. Or if we go into the right side, I think we will be able to see the bronchoscope coming out of here. And that's how much we can go in with the actual bronchoscope as well, because the tinier these bronchioles become, the harder it is to get into them. Yeah, so overall, I'm really impressed with the 3D printed model.